Hello, everyone, and happy new month. It's February already. As you know, people don't have access to their doctor when they need it. And so, as a result, some have turned to telemedicine for treatment, which is video or phone visits. And today I want to discuss 3 things to consider before scheduling your next telemedicine visit. So, welcome to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. This is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. I'm your host, Lola Ashaye. I'm a double board certified family and lifestyle medicine doctor and owner of InTouch Primary Care, a membership clinic in the Sugar Land area in Texas. And I am so excited that you're here. If you are seeking a much more convenient and proactive approach to your healthcare, come and join us. You can enroll at www.intouchprimarycare.com. And remember, you can listen to this episode and all our other episodes on the InTouch Primary Care YouTube channel. Please leave comments, subscribe, and please share with someone that might need it. You never know, it could make a huge difference for them. Okay, so this week, I had a patient with abdominal pain, and while we're talking about the pain, we came up with a plan. We're just talking about it. Like I said, okay, let's do this and do this and do this. And then I examined her, and then I was like, no, I think we need a different plan. So we changed the plan based on the exam. And then a few days ago, about 2 days ago, I talked to another patient who had some cold symptoms for a few days. She had some sick contacts, and after talking to her, did a long exam, decided that I needed to do more testing, which we did, and it turns out that the more testing was abnormal, and so she needs more tests still. So I was thinking about these 2 scenarios, and the truth of the matter is, if I did not see these people in person, my plan would have been different, my management would have been different, and probably would have been, their care would have been delayed because I would not have had all the information that I needed. And so I was thinking about telemedicine, which is something I used to in my practice, but I wanted to talk about it because there is a proper way to use it and a proper way not to use it. Okay, so telemedicine, video phone visits. So because sometimes it's so difficult to get in with your doctor, it could take weeks or even months to get in. A lot of people have turned to telemedicine, and some people don't just do telemedicine, don't just do it as needed. Some people, that's all they do now. So they don't see their doctor anymore. Every visit is a phone or video visit. But before you can do this, there are some things you must consider, and please listen. So number 1, let's talk about some questions that come up commonly. So what are common acute conditions that maybe telemedicine is okay for? So this is not meant to be medical advice, but just, based on my experience, these are some of the things that with telemedicine probably can handle. So if people have mild to moderate infections, especially things that have typical symptoms, like, for example, strep throat, very typical symptoms, headache, sore throat, fever. It looks like strep in the back of the throat. Is very painful. That you can probably treat as long as you have their allergy information and that sort of thing on file. Things like sinus infections, they've had symptoms for, a week or so, still having symptoms, they're congested, one side of the face is painful, that sort of thing that you can probably treat pretty easily, straightforward, treatment. Or even things like allergies or even a urinary tract infection in some people, not in everybody. In some people, you could probably get away with treating with telemedicine. And many rashes. So rash, you can actually show it to the doctor over the camera. So that's a very good one that can be treated usually. So those will be some of the things that, people can treat with telemedicine. Now, what are conditions you should probably avoid treating with telemedicine? So I would say it will be anything where it'll be helpful for your doctor to examine, and or things that are non-specific. So for example, if you're dizzy or lightheaded, Dizzy or lightheadedness can be caused by so many different things. So it's nice to have an exam to confirm that nothing else is going on. Or if it's, symptoms regarding your chest or your lung or your abdomen, it's helpful to have a physical exam, because the physical exam, as I mentioned in those two examples, can really change what you end up doing. So those will be the scenarios where I would say it's helpful to, there are benefits of using, of having to see a doctor in person. So what are benefits of using telemedicine? Well, the biggest one is convenience, right? You can get your question or your concern or your condition addressed pretty quickly, which is great, right? It's quick, it's easy, can be very efficient and beneficial, but there are risks, right? So telemedicine has its limitation. It can be harmful when used inappropriately. And the main issue is it's really impossible to do a thorough exam when over telemedicine, right? You can only do so much over video and definitely less over the phone. So sometimes the severity of a condition can be underestimated or it can be overestimated, but either way, that can cause problems. Also, sometimes things can be missed. So here are some tips before your next telemedicine visit. Number one, I'll say try to do a telemedicine visit with a doctor that already knows you. So I think this really limits the risk of problems. So especially one that has recently examined you. Why? Because they're familiar with you. They have your history. They have your medical records. They know what you typically sound like. If you're doing video, they know what you typically look like. So it could be really helpful to just have somebody that already knows you doing a telemedicine visit with you, because it will make the risks lower and you can still get the convenience that you desire. And then if things don't, if something happens, the treatment, the management plan doesn't work, you can follow up with that person in person, which now they have your history. They know what you look like when you talk to them on the video. Now they see you in person. It makes a lot more sense. It also saves you a lot of time and money, because when you're going from one doctor to the other, a lot of times things are repeated. I've seen this over and over again. They're repeating tests unnecessarily because we can't find them. They are repeating, things that have already been done because we don't know, what the results are. So you're saving time and money by following up with the same person. And then that way also, it's less likely when we have your history that things are missed or under or over treated. Okay, so that's one. Second thing is, if that's not possible, say you don't have a primary care doctor you can find, or you're not in a membership practice like ours where people can get in easily, where they can do telemedicine as needed, it's very convenient. Say you are still in the traditional care system, well, I would say try to limit your telemedicine to conditions that you can show easily, or that have obvious typical symptoms. So remember that your doctor is relying on available information. Whatever you present is what they can make decisions on. So the information you give us that's all we have. So if it's not something that you can show easily, like a rash, or something that has obvious symptoms, like I mentioned some of those things earlier, strep throat, sinus infection, things like that, it's easy to miss something else. And I've seen this happen. So it's easy to miss if it's not obvious, or if it's something that is not typical. So you definitely want to limit how you use telemedicine, especially if you're not following up with the same doctor for that. And then the third tip I'll say is give as much health information as you can. So it's really important to know your medical history, to know your allergies, your medication doses, your social history, your family history. All those play a role. So if you don't know your medical history well, you probably don't want to use telemedicine. So for example, right, obviously with allergies, if you didn't tell the doctor that you're allergic to penicillin and they treat you with an antibiotic that is penicillin, that's obviously not a good idea, right? That's an obvious one. But there are other things that are more subtle. So I've had, there are cases where somebody's taking a blood thinner you didn't tell the telemedicine doc you were taking a blood thinner. They don't have your history. Maybe you didn't even know it was a blood thinner. Now they give you ibuprofen for knee pain or headache or something like that. And then you bleed internally because of too much, because those two medications can cause internal bleeding. So a very serious complication from something like that. So that can happen. Another one is, sometimes people have nausea and they see a telemedicine doctor and they give them an antiemetic, a nausea medication. Maybe they didn't mention they're taking a depression medicine or anxiety medicine. Those medications can interact. That's another problem that can be caused. Excuse me. So even things like not mentioning that you're a smoker and maybe you have symptoms of a cough or some other symptoms, and you didn't mention that you used to be a smoker or you're a smoker still, and then they don't give you the appropriate antibiotic because that was not information that they had. So there are many little things that sometimes is not obvious to the patient that changes what we do. So it's important that you know your history and you give as much information as possible and make sure that you're not being rushed through your telemedicine visits, because that can cause serious complications when things are missed. So I think the point is, telemedicine is nice. Can be very helpful. It was helpful, during COVID to have that as an option, but it's not without its flaws and limitations. And so it's not a good idea to rely only on telemedicine for your healthcare. You want to make sure that when you do it, that you are doing it safely. You also want to be careful about taking medications without proper evaluations. Even over-the-counter medications can put the strain on liver, on kidneys, or other organs. You want to make sure that if somebody's prescribing you something, you've had labs done, in the appropriate amount of time, because they may not be giving you orders for labs and the medication that is being prescribed may be harmful and they don't know because nobody has checked your labs in years. So there are serious implications. So don't just take it so lightly. So I hope that helps. Remember, try to do a telemedicine visit with a doctor that already knows you. That's number one. Try to limit telemedicine to conditions that you can show easily or have obvious typical symptoms, and then give as much health information as you can. So those are the tips for today. And if you're in the Houston area and you're looking for a doctor you can follow up easily and consistently with, one you can do telemedicine with that knows you and is proactive about your care, check us out at InTouch Primary Care. If you want to get to know us first, you can schedule a one-time detailed evaluation by selecting a per-visit visitor consultation. You can find more about all of this on our website, www.intouchprimarycare.com. Remember, your health is too important to rush. It's too important to ignore. You need your health to enjoy doing what you love. So prioritize your health today. And if you know anyone that may need this, please share this episode with them. And please subscribe and leave us comments as well. Thank you. See you next week at 2:15 p.m.